Welcome back to the channel. My name is Dan, pharmacist and owner at MD Custom RX. In today's talk, I will be discussing with you three categories, or culprits if you will, that negatively influence thyroid hormone production. The first category that we'll be looking at is lifestyle and environmental factors. The second category that I'll be looking at are nutrient and vitamin deficiencies that negatively impact hormone production. And the third category, and probably the most important in my opinion, are prescription medications that again can negatively impact the way our thyroid gland works and the way that our thyroid gland produces hormone. If you stick with me to the end of today's talk, I will be sharing with you my favorite and I think clinically most effective thyroid preparation out there on today's market. Okay, so let's get into today's talk. Possible causes of low T4 production, lack of raw materials. I touched on this a little bit, but you need iodine and you need tyrosine. Tyrosine is usually not the rate limiting factor, it's usually iodine. Iodine gets pushed out by other halides, so chlorine in your water, get rid of that. Bromide, there's bromides in breads. Mountain Dew has bromide, there's bromides everywhere. And then my biggest culprit is fluoride. Fluoride in toothpaste, fluoride in the water. You can actually measure all of those halides in your body. If they're in there, we got to get them out, get you more on iodine. Do you know your iodine level? Most patients don't know their iodine level. It's never been tested. If you have been diagnosed with hypothyroidism, I strongly encourage you to get your iodine level checked. It could just be a raw material issue. You might not have enough iodine. You don't have to be on thyroid medication the rest of your life. I don't want you to be on thyroid medication for the rest of your life. I'd rather you just fix the problem, get to the root cause of it. If you're iodine deficient, get on iodine responsibly, work with a doctor that knows how to prescribe iodine. Because you can run yourself into a lot of trouble if you just go out willy-nilly and get some iodine online, which you can very easily do, but I don't encourage you to do that. Get your baseline level tested, work with somebody that knows how to dose iodine appropriately. So key point, cortisol downregulates T4 production. So as your stress level goes up, your cortisol level goes up, and your T4 production, your thyroid hormone levels go down. Pituitary hypofunction. So going back to that screen where there was the cascade of the whole endocrine, well, part of the endocrine system, you could just have a poorly functioning pituitary gland. It's not cranking out the TSH. Your TSH might be very low, and that could be the cause of your problem. There's a pituitary extract made by Standard Process that I like for that particular issue. But again, we have to go and measure that. We have to go find that out. Poor nutrition. I said rule out hypochlorhea. What is that? It's low stomach acid. I am probably as a pharmacist, the least favorite drug class in my mind are antacids. All the PPIs, the Nexiums of the world. And I'm not saying that we should never use them, but we need to use them more judiciously. I think they're way overused. And so you could have a patient that has hypothyroidism because they are on an antacid, which is inhibiting them from absorbing their iron, which you need, which we just learned you need that for thyroid hormone function. They're going to reduce their amount of magnesium, which activates their vitamin D, which then if it's not activated by the magnesium, their vitamin D doesn't work. If their vitamin D doesn't work, they don't convert T4 into T3, and then they don't absorb calcium. So they could just be on a PPI. I have patients at least every month that comes in. I've been on a PPI for 10 years, and I heard you're the pharmacist that can help me get off of my PPI, my antacid, and I certainly can help with that. So sometimes you could think of a drug that's not even related anything to do with thyroid, and that could be causing your thyroid problem. Selenium, we'll talk more about that when we get to the supplements, but that's a key ingredient. We got to look at our selenium levels. Talked already about iodine. If we don't have enough iodine, we're not going to produce enough thyroid hormone. Tyrosine, but that's an amino acid. You can find it in a lot of supplements if we're actually have really poor protein absorption or protein metabolism. I might encourage somebody to go on tyrosine. Iron, magnesium, vitamin D, vitamin A, these are all fat-soluble vitamins here. So if we're not good at absorbing fat-soluble vitamins, that could be an issue. And then vitamins B2, 6, and 12. Again, all things that we can measure. If we're deficient on any of those, we need to get those numbers back in line, and that in turn could just fix the thyroid issue. Poor conversions of, again, T4 into T3, so stress, so high cortisol. High cortisol will inhibit the enzyme in the body that is responsible for converting 4 into 3. Aging, just in general, can be a problem. Malnutrition, so poor protein intake or metabolism, that kind of goes back to that patient that's on an antacid or some kind of GI disruption. If they can't metabolize and break down proteins well enough and not get enough tyrosine out of those proteins, that could lead to a problem with low T3. Alcohol excess, obesity, radiation, toxins, heavy metals, especially lead and mercury, are big problems for thyroid function. Infections, trauma, surgery, obviously all those can be leading to high cortisol levels. So you look at that list and there's not too many people left over there. Don't apply to one of those. That's why I think that number is a lot bigger than 12%. Internal and external inhibitors of thyroid hormone. Talked about stress already. Toxins, pesticides, herbicides. There's glyphosate. I can never say that word. Roundup that's sprayed everywhere. That can be problematic. Heavy metals. Again, radiation. The big one for me that I look at, fluoride toxicity. So if you look at like the fine print, so SSRIs are the drug class of antidepressants, so your Prozacs of the world. They have, I can't remember how many fluoride molecules. I think there's 3 of them on the Prozac molecule. Somebody's taken Prozac for 10, 20 years of their life. All that fluoride is kicking out their iodine. That could be the cause of their hypothyroidism. If you look at the fine print of the drug package insert, way on the bottom, warnings and precautions may cause hypothyroidism. How can my antidepressant do that? It's because of all the fluoride that's attached to that Prozac molecule that's then pushing out your iodine and not allowing you to make enough T3 or T4. So you're like, and one of the signs and symptoms if you have a whole hypothyroidism is like low mood, probably depressed, constipated, dry skin, your hair's falling out, you feel like crap. Maybe it's your thyroid. Maybe you don't have any depression at all. Toothpaste, drinking water. Just make sure, I always recommend having like an RO or some kind of, don't ever drink just regular water. Have it filtered, have it cleaned up. We use an RO system at our house. We have an RO system here at work. Get rid of all the crap out of the water. Drink clean water as best you can. And we'll get into medications here in just a minute. So medications that alter thyroid hormone, again, conversion, production, or binding. So there's a lot that can go wrong here. Birth control increases thyroid binding globulin. So you put a patient on birth control, and 6 months later, they're complaining of all these hypothyroid symptoms. If you look at just their TSH might be fine. But then you go and look at their T3 or their T4, their free fraction of active hormone, it's gone down, way down, because you're giving them an oral estrogen, and that's creating more of this binding protein, and so you're basically sequestering that patient's T3 and T4 tied up into this protein. So, if you know anyone that's complaining of, symptoms after they've started birth control, it could be because you've increased their binding protein. Let's go and measure their binding protein. Let's see if that's actually what's causing it. Hormone replacement therapy. Because we do a lot of bioidentical hormone replacement here, I always like to touch on this. So oral estrogens increase thyroid binding globulin. That's a bad thing. Transdermals, which is what we promote here, one of the many reasons why we do that is it does not increase thyroid binding globulin. So if you're on oral estrogen, again, I'm not saying it's always an issue, but if you have hypothyroidism, we should be looking at that thyroid binding globulin, measure that level. If it's elevated, okay, then maybe we should switch that patient from oral estrogen to a transdermal. So, beta blockers, so I just listed a few of the examples, but you've got atenolol, metoprolol, These are all the generic names. Anything that ends in typically in OL, it's pretty much a beta blocker in the pharmaceutical world. Carvedilol inhibits, again, we talked a lot about this, but it inhibits the enzyme that converts 4 into 3. So always think 4 is inactive, 3 is active. If I'm taking a beta blocker, one of the side effects for beta blockers too is that you're tired, you're fatigued, and that's partly because you're slowing down the rate of your heart to lower your blood pressure. But maybe they're feeling like crap and they can't exercise because now you've just lowered their thermostat because you're not allowing that thyroid to be converted from inactive to active. So we got to think about some of those things. Yep. Can you tell I'm not a big fan of beta blockers either? It's probably like my second least favorite drug class out there. Anti-manic drugs, I don't see a lot of that just from my experience. I know they're out there, of course, but like lithium decreases thyroid synthesis. I thought I'd put that on there. So big picture for me, just, if you're suffering with hypothyroidism, if you've been diagnosed with hypothyroidism, have somebody go through your meds and see if there's possibilities there that might be the cause. Medications that alter thyroid hormone conversion, again, production, this list keeps going on, I'm sorry, low progesterone. So if that patient doesn't have enough progesterone, that decreases enzyme conversion. So you want to, if the patient's progesterone, we measure it all the time and patients come back, postmenopausal, their progesterone is in the tank. It's in the basement. It doesn't even exist barely. That's relating to some of their hypothyroid symptoms. So we got to actually give them progesterone to get that conversion working again. Low vitamin D. Talked about this already, but decreased enzyme, again, responsible for conversion. If you have low vitamin D, you're not converting as well as you should be. Again, measure your vitamin D level. That could be part of the contributing factors to why your thyroid is not working the way it should. Iron, calcium, magnesium, so decreased thyroid medication absorption. So what do I mean by this? So if you're on thyroid medication right now currently, you want to take that first thing in the morning. I think that's my next slide. Nope, that's not. You want to take that first thing in the morning, empty stomach, 30 minutes before food. The reason you want to do that is if you take thyroid and you take, let's say, a multivitamin that has iron or calcium or magnesium, that thyroid hormone is literally going to bind to that mineral and you're not going to absorb either one of them. So you've done yourself a complete disservice by taking your thyroid hormone replacement with minerals. So don't do that. Just plain glass of water first thing in the morning, wait 30 minutes before you eat or take any other supplements. I hope you learned a few things about the many culprits, unfortunately, that can disrupt your body's thyroid hormone production. As I promised at the beginning of this video, I would share with you my favorite thyroid hormone replacement option, which, as a biased opinion, is compounded T3 and T4 in a slow-release capsule. The reason for that is your prescriber can independently adjust both the T3 and the T4 doses independent of each other. And the slow-release capsule helps so that your body is slowly absorbing the medication as it normally would do from an exogenous standpoint when your body releases T3 and T4 into the system. If you are on thyroid medication currently and are trying to figure out which medication, which dosage form is right for you, I encourage you to look at my other YouTube video entitled Thyroid Medication Preparations, the many different options. And if you found value in today's content, I encourage you to share that with a loved one. As always, thank you, and we'll see you next time.